Here we introduce an easy technique for arthroscopic reduction and double pulley fixation of bony Bankart lesion by percutaneous spinal needle suture passing. All the authors have no conflicts of interests. 49 years old female patient with the right shoulder injury is placed in a standard lateral decubitus position. The standard posterior observation portal and the anterior working portal are mated. The hematoma is cleaned up by a shaver, confirming the presence of the bony Bankart lesion. The arthroscope is switched to the anterosuperior lateral portal, where a global view of the glenoid can be obtained. Cleaning up the hematoma in the lesion site by a shaver, till to the medial edge of the glenoid bony Bankart lesion site. Through the anterior operating portal, a doubly loaded suture anchor is inserted into the midpoint of the medial margin of the glenoid bone bed, pulling out the anchor sutures by a suture grasper through the posterior approach. With the standard observation posterior portal, we insert the 12-gauge spinal needle percutaneously below the anterior portal to penetrate the subscapularis tendon and capsule, reaching the midpoint of the articular surface of the glenoid fracture fragment. One end of a PDS suture is introduced into the glenohumeral joint through the spinal needle. The arthroscope is switched to the anterosuperior lateral portal, and the end of PDS inside the joint is pulled out using a suture grasper through the anterior approach, retrieving the spinal needle back outside the joint capsule, and then insert the spinal needle again along the front beveled edge of the avulsed fracture fragment, penetrating the capsule again and reaching below the Bankart fracture fragment, pulling out the other end of the PDS by a suture grasper through the posterior approach. Outside the glenohumeral joint, replacing the PDS suture with a high tensile suture, which functions as a traction suture. All four limbs of the medial anchor suture strands are passed through the medial edge of the fracture fragment with the traction suture from the posterior portal to the anterior portal. With the observation anterosuperior lateral portal, and the operation anterior portal, respectively, two doubly loaded suture anchors are positioned proximally 1/3 and distally 1/3 of the lateral articular edge of the glenoid bone bed. A semi-open retractor is placed as operating channel through posterior portal. Strands of one suture from the articular distal anchor and strands of one suture from the medial anchor are pulled out. Two strands from different sutures are tied outside of the joint with a static surgeon's knot. The other two free strands of different sutures are pulled and tightened. This delivers the knot through the channel and down back to the lesion site. The sutures of the medial anchor and articular proximal anchor are manipulated as the same procedure through the anterior portal, delivering the knot back fracture site. Then the left two free strands of different sutures are retrieved, and a static knot is tied with the knot pusher. An arthroscopic osteosynthesis is satisfactorily achieved.